All right, good afternoon again, and welcome to our Calhoun County Joint Information Center about our countywide COVID-19 response. I'm your host today, Jessica Vanderkolk, one of our COVID-19 public information officers, standing in for our emergency managers today. Just flipping through our administrative notes. Our unified command team of Kelly Scott, Rebecca Fleury, and Eric Pessel. Our usual lines of effort and priorities. Our purpose of this Joint Information Center. And our agenda for today. So we will go ahead and get started with our countywide situation with Eric Pessel. Go ahead, Eric.
Okay, thank you, Jessica, for that introduction, and good afternoon, everybody. So, a little bit about what's going on currently with COVID in our community, and things are looking much better, much improved from the last time we spoke, certainly the last couple times that we've spoke. So, just real quickly on the numbers on the left-hand side, we are up over 28,000 now confirmed cases since the beginning. Currently, today, we have 17 patients in-house in our two hospitals that are COVID patients. We've had a total of 513 deaths. I will say that 17 patients, at least one of our hospitals had 0 in critical care today, which hasn't happened in a very, very long time. So things are really looking a lot better on the hospital front. As you can see in the right side, I always pay everybody's attention to the right side of the graph. That's the Omicron surge that you can see there that was happening right about the middle of January. And you can see it precipitously falling off on the very, very right-hand side, which is where we currently are today. Things, because of this and because things change, I don't have a slide for this, but I am going to announce this today. Also, before I announce this, I wanted to also say that Dr. Nelton is with us as well. And Jessica, he may jump in and speak about a slide or jump in. So I don't know if he has to be turned on or if he's okay to just be able to jump in on his own. Sounds like it's okay for him to jump in on his own.
Yep, so anyway, you can jump in anytime.
Okay. So just a little announcement that I don't have a slide for, but at Calhoun County Public Health Department has decided to revoke their quarantine order. The quarantine order I issued back in May of 2021. That will be effective Monday, February 21st at 12 a.m. There'll no longer be an order for quarantine. We still recommend folks quarantine if they are close contacts, especially in the workplace, for at least 5 days and test on day 6. Also, I think that there'll be some information coming out about, in general, masking across the state of Michigan. That may come out later today. And I think, the biggest takeaway I have with what's going on right now and the messaging that's going to come across, and there's going to be a lot of messages, and folks just need to try to, work through it all and try not to get confused, because that's what I'm afraid of, is there's going to be so many different messages. We won't know which one to trust. But bottom line is, I think as we move forward, we'll empower our community members to make the best choices for themselves in their situation. Doc, did you have any input?
Yes, thank you, Eric. Good afternoon, everybody. I think it's important to just recognize and acknowledge that for the last 2 years, public health, we've often made recommendations, enforced requirements when evidence has changed or the situation has changed to increase mitigation measures to reduce COVID-19 spread and also the risk of severe COVID-19 disease. And we're entering kind of another phase where the risk is decreasing at a time when we have the availability of multiple mitigation measures available to us, whether that being a high quality, well-fitting mask, vaccinations, boosters, and medical therapeutics such as pills and also monoclonal antibody therapy for early treatment to prevent the spread of severe disease. So when the evidence changes and also when the situation changes, public health recommendations change too. And that includes, again, both when we increase mitigation measures and also when we decrease mitigation measures as well. So I think that's both what Eric and I are underscoring today. Back to you, Eric.
Thanks, Doc. You go ahead to the next slide, please. So a little bit about the data that we're seeing, and this is the rest of my presentation today is kind of just an update of overall what's currently going on. This is some data from CDC through December, and it's what we've always known, and it kind of really shines a light on our focus over the next couple months is to really try to figure out a way to get those that have chosen not to be vaccinated to somehow get them to make the choice. The best choice for them is to become vaccinated so they don't become a statistic. And that's what we want to avoid. And you can see it's very clear now that unvaccinated adults who are 65 and plus infected with COVID are 49 times more likely to be hospitalized than a 65 plus that was vaccinated. And you can see the 18-year-old as well. We're 16 times more likely to be hospitalized if you're 18 plus an unvaccinated adult. And, as we get more and more data, more and more things like this we'll be able to share with the community. And it just all circles back to, as Doc said, we have all of these tools in our toolbox, and the number one tool that we have continues to be vaccine. Next slide. So our data here in Calhoun County regarding boosters, you can see the top graph is a graph of our fully vaccinated by age demographic. And I want to point you to that 65 and older age demographic. And you can see that about 85% are initiated, maybe 80% completed, fully vaccinated for the 65 to 74 year age group, and over 75 is about 75% completed. But then the bottom graph is of those that are fully vaccinated and completed, how many have been boosted? And again, that higher age group, where above 70% have also received their booster. That is important. It's important knowledge for us so we can make sure we're focusing on those at the highest risk. And I would like to see that 71, 72% of our older generation, I would like to see that even increased with a booster, because we know, especially like with Omicron and whatever the next variant will be, it will affect those in that age group harder than it will in other age groups. So if we can raise that 70% boosted up, that would be a great thing. And you can see as you would expect, it just goes down across the age groups until you see the 12 to 15 year olds, we're at 16% boosted. Next slide. So this is just a slide of the emerging variants. And I think when I looked at this, it was like, whoa, this looks like a big painting. But the orange there, the big orange, that was the Delta variant. You can see how that was a very elongated surge. It goes all the way back to really May and lasted until early December. And then you can see where Omicron took over from early December until currently. And as we move forward and our situation, like Doc said, our situation has changed on the ground, and we're going to continue to look for any additional variants of concern. And we'll be watching that very closely. And if perhaps one of those does rear its ugly head and decide that it's going to make its way to the United States and it's going to cause us some additional problems, then I think at that point, that's where we'll look at maybe what mitigation efforts we should put in place to deal with that emerging variant. But for now, as we said, the Omicron surge is significantly reduced from where it was. And I think moving forward, we're in a much better place now than we were just a week or two ago. So I think that is it, Jessica.
Yes, and thanks again to our health officer, Eric Pessel, and our medical director, Dr. William Nettleton. We're going to pass it over now for some slides that our Battle Creek City Manager, Rebecca Fleury, will share with you.
Thanks, Jessica. Thanks, Eric and Dr. Nettleton. You're always a hard act to follow. Just some really good reminders right now. And I know it doesn't seem like spring is coming, but it is coming, despite maybe some weather we might have at the end of this week. But I think the most important thing of this particular slide is if you're sick, you should really be talking to your healthcare provider, because we don't want you to assume that it is a seasonal allergy versus perhaps needing a test for COVID. Because as you can see from this graph, they have very similar symptoms, but not exact symptoms. So we encourage you greatly to reach out to your healthcare provider if you're experiencing any of the symptoms that you see on the side, because they are different and they should be treated differently. And please rely on your healthcare provider for that. Next slide, please. Some vaccine news that we're sharing today. Many of you heard, but we want to make sure that we lift this up. On the last day of January 2022, the U.S. Food and Drug Administration approved a second COVID-19 vaccine, and we have been referring to that vaccine as the Moderna. Both Pfizer and the FDA have pulled back from plans to expedite review of COVID-19 vaccine in young children, those children under 5. Just because of new data not showing adequate efficiency with 2 doses. And lastly, the CDC is considering expanding the interval between the first 2 doses of the messenger RNA. So they may push the 3 to 4 week intervals to 8 weeks. So we'll make sure that we're communicating that if and when that decision has been made. Next slide, please. Tests, masks, and vaccines. As you heard Eric say, really the most important thing that we can encourage people to do is to vaccinate if you have not. But all of these 3 things are important in our response to the COVID virus. So please visit the Calhoun County MI.gov site for resources to find the free offerings of K95 masks, of vaccines, and of course the COVID-19 at home tests. And hopefully you've also applied for that through the federal government for the free tests there. So remember to test, mask, and vaccinate. Next slide, please. Here's just a little more information on where you can get free KN95 masks in Calhoun County. As you can see, there are many locations, and hopefully that if you're in need of KN95 masks, that you can visit one of these particular locations, whether it's in Albion, whether it's in Marshall, whether it's in the city of Battle Creek or other places. Please feel free to reach out and receive those free resources. And then there's a nice little graphic on this slide about how to wear a KN95 mask. I think I heard Dr. Nettleton say, as well as Eric, that you do need a well-fitting mask for it to do its job. And while it seems second nature to us, you do want to make sure that when you are using a KN95 mask, that you are wearing it properly. And all this information can be found at the Calhoun County MI.gov site. Next slide. And I will pass it back to you, Jessica.
Great. Thanks, Rebecca. That is one of our Unified Command Team members, our Battle Creek City Manager, Rebecca Fleury. And so we are going to move right into comments from our elected officials. We did hear from a representative from U.S. Senator Peters this last week. And so I want to offer him or his representative the opportunity to speak if anybody from his office is on today.
Yes, this is Eric Keller with Senator Peters' office. Thank you for the time and thank you for the information. I wanted to introduce myself. I know I've met with several folks that are on the committee. I'm the Senator's new regional director in mid-Michigan out of our Lansing office, and so that is my introduction on that front. I participated in several JOCs throughout the pandemic, and based on the information I've heard from Calhoun County, I just want to thank all of you, each and every one of you, for your efforts in terms of coordinating and sharing information in real time. The Senator stands with you in terms of bringing federal resources to bear. He's obviously very engaged at the federal level on legislative efforts to provide resources. He's also chair on Homeland Security and Governmental Affairs, which has direct oversight of FEMA. So, over the course of the last 2 years now, has worked very closely with the federal agencies and coordinating at the local level. And just want to thank you for providing information. If there's anything the senator can do to be more of assistance, feel free to reach out to myself at any time, and happy to work with you. So that's all I have, but thank you very much, and look forward to working with you in the future.
Thanks, Eric. Thanks for joining us today. It's good to have you on. We will move on next to Senator Bison, if there's anybody from the senator's office today.
Hi, Jessica. Thank you. Hi, everyone. This is Karen Todd. I'm sitting in for Senator Bison today. He's in meetings this afternoon. Just a couple of things. I'm sure you all have heard the governor released her fiscal year 2023 budget, just over $74 billion. I do have a budget analysis available if anyone is interested in taking a look at that. And also additional reasons for waivers to unemployment overpayment notices have been granted since the last time I reported. So if constituents are receiving overpayment notices, they may qualify for a waiver of that overpayment. So we urge them to contact the UIA or Senator Bison's office, and we can assist with getting you in contact with a UIA agent to try and get that taken care of, if it's at all possible. That's all that I have today, Jessica. Thank you.
Great. Thanks for the update, Karen. We'll move on next. I saw Representative Hadsma on the call today. Do you have an update for us?
Thank you, Jessica. I don't have anything to add beyond what Karen Todd has added. I'll be running across the street to the Capitol just now. I appreciate continuing to participate in these meetings, and thanks for the good news from Eric Pesso and from Dr. Nettleton.
Great. Thank you, sir. Good to have you with us today. Do we have anyone from Representative Hall's office with us today? Okay, I don't hear or see anyone. Do we have any county officials with us today who wanted to make comment or give updates? All right, I don't see anyone from the county. Do we have any of our tribal elected officials with us today who want to give updates? All right, I don't hear anyone from there. Do we have any city elected officials with us today who want to give updates? Don't hear any city officials. Do we have any township elected officials who would like to give updates today? Hearing none, do we have any village elected officials with us today to give updates? All right, I think we can move on and wrap it up today. As always, these are your best sources for the most up-to-date and accurate information that we have to provide to you. So keep up with those local, state, and federal COVID websites. And as always, your three public information officers, Lucy, Victor, and myself, for all the information that you need. I don't see anything in the chat today, so we will go ahead and wrap up this COVID update. Thank you all for joining us, and we will see you next time.